A pleasant day to everyone. I am Miss Cherdyn B. Mojica, RMT, MPH, a registered medical technologist assigned to ABG Unit Pulmonary Medicine of UPPGH. For today's lecture, I'm going to discuss about arterial blood gases, its laboratory analysis, and clinical significance. To outline our course today, we're going through the different terms related to ABG, specimen collection, instrumentation, laboratory analysis, interpretation and normal values, and clinical utility. So let's start with the terminologies. Arterial blood gases measures numerous blood values to determine how well your lungs and other organs are working to transport oxygen and remove carbon dioxide. pH, or potential of hydrogen, is a measurement of the acid-base balance in the blood and is used to monitor how well your kidneys are functioning. PCO2, or partial carbon dioxide, measures the pressure of blood carbon dioxide and is used to monitor how well your lungs are working to remove the waste product, carbon dioxide, from your body. Bicarbonate, or HCO3, is an indirect way to measure the amount of carbon dioxide in the blood and is used to monitor how well your kidneys are functioning. PO2, or partial oxygen, is an indirect way to measure the amount of oxygen in the blood and is used to evaluate how well your lungs are functioning. Oxygen saturation measures the amount of oxygen that is bound to hemoglobin, which transports oxygen to all the cells of the body. Total carbon dioxide is the N minus the combination of all the various forms of carbon dioxide in the plasma in equilibrium with the whole blood. Base excess of blood, or BEB, measures the total body bases in hemoglobin, chloride, phosphate, sulfate, albumin, and the magnitude of metabolic component. Acidosis, presence of a process which tends to lower pH by virtue of gain of hydrogen ions or loss of bicarbonate. Alkalosis, presence of a process which tends to raise pH by virtue of loss of hydrogen ions or addition of bicarbonate. Respiratory, process which lead to acidosis or alkalosis through a primary alteration in ventilation and resultant in excessive elimination or retention of carbon dioxide. Metabolic, process which lead to acidosis or alkalosis through their effects on the kidneys. For ABG equipment, we have arterial blood gas kit. Usually they are pre-packaged containing pre-heparinized 3 to 5 cc syringe, 2 pieces 22 to 23 gauge needles, gauze pad, alcohol swab, biohazard bag, and other items. For specimen collection, we have different sites of selection: the brachial, radial, femoral, and dorsalis pedis. The best site is the radial artery. It is located superficially, easy to palpate and stabilize. Excellent collateral circulation by ulnar artery, and it is not adjacent to large veins unlike the brachial artery. If you're going to extract blood from the dorsalis pedis, you need to ask first the patient if he or she has diabetes because there's possibility of delayed healing of the wound from the needle prick. There are different insertion angle for each site selection. If you're going to extract blood from radial artery, it requires 45 degrees insertion angle. Brachial artery requires 60 to 90 degrees insertion angle. Femoral artery requires 90 degrees insertion angle, and dorsalis pedis artery requires less than 45 degrees insertion angle. Site must be adequately compressed until clotted, approximately 5 minutes, and patients receiving anticoagulation therapy takes longer. So what is Allen's test? It is a test done to determine the collateral circulation is present from the ulnar artery in case thrombosis occur in the radial. The following are the potential complications or hazards in ABG specimen collection: pain, hematoma, hemorrhage, trauma to vessel, arteriospasm, air or clotted blood emboli, arterial occlusion, vasovagal reaction, and infection. I have here a short video clip to demonstrate ABG sampling or blood collection.
Hi there, my name's Andrew. I'm one of the final year medical students. Could I just check your name and date of birth, please?
Sure, it's James Alexander, 13th of December 1989.
Nice to meet you, James. Today I've been asked to do a procedure called an arterial blood gas. This involves taking some blood from the artery in the wrist. I'm going to use some local anaesthetic, so it shouldn't be painful, but it might be a bit uncomfortable. Is that okay?
That sounds fine.
Can I just check before we begin? Have you ever been told you have problems with your circulation? Okay. Do you take any blood thinners, such as warfarin?
No, I don't know.
Okay. And have you ever been told that you have problems with clotting?
No.
Brilliant. Can I also check, James, do you have any allergies at all?
No, I don't.
Brilliant. I'll just gather my equipment. James, I'm just going to do a quick test to assess the blood supply to your hand. Could you just make a very tight fist for me? And hold it there. I'm now going to press on each side of the wrist. Keep your fist as it is. And relax. James, that's the end of the procedure. Thank you very much.
After collection, the sample must process immediately, not more than 30 minutes. And if there will be any delays, the specimen should be immersed in slurry ice. Next, I have here a short clip on how to process ABG sample. This is our current machine in PGH. For your additional info, here's the components and parts of the cartridge of our machine in PGH. Earlier machines, until last year, our machine is made of these electrodes. And here's the principle of our ABG machine. The measurement of pH is called potentiometric analysis. It has been reported that the difference in electrical potential could be measured between two solutions of different pH separated by a thin glass membrane. A potential thus produced varies with the hydrogen ion concentration of two solutions. The glass membrane is sensitive for hydrogen ions. It is on this principle that the glass electrode is concentrated for pH measurement. pH is made of a sensitive glass electrode, and reference electrodes is made of silver chloride tip. Both electrodes is immersed in bicarbonate buffer solution. On the other hand, the principle of CO2 or PCO2 electrode is a test solution. Arterial blood separated by plastic membrane permeable to gaseous CO2 but not permeable to dissolved ions. CO2 blood diffuses through plastic membrane and react with the buffer system. The hydrogen ion concentration change due to the dissolution of CO2 is detected by the pH-sensitive glass electrode. A potential difference exists between glass electrode and reference electrode. This is measured on the meter, and the meter scale is usually calibrated for in semi-logarithmic fashion since pH is inversely proportional to the log of PCO2. In this slide, I would like to show you a sample of our ABG result form. Next, we're going to discuss the steps to ABG analysis. The first step is to look at the pH. When we look at our ABG result, we don't want to talk about the values in terms of being high or low, but we're going to talk about them in terms of being normal acidotic or normal alkalotic. So let's take a look at the first step. We ask if the pH normal acidotic or alkalotic. Step number 2, we ask if the CO2 normal acidotic or alkalotic. And step number 3, we're going to ask if the bicarbonate is normal acidotic or alkalotic. Next, we're going to look at the CO2 and the bicarb and determine which one of these matches the pH. So in other words, we're looking at the ones that have the same interpretation. If the pH is acidotic and the bicarbonate is acidotic, those of the two that match. After we made that determination, next we move on and look at the CO2 and bicarb to see if one goes to the opposite direction. If one goes to the opposite direction, that is called compensation. And last, we're going to assess and look at the PO2 and oxygen saturation to tell us about the patient's oxygenation. But before we can analyze our ABG result, we must familiarize ourselves with normal blood gas values. Please take note of the difference between the values of arterial blood and venous blood. The normal values of pH ranges between 7.35 to 7.45. PCO2 normal range is 35 to 45 millimeters per curie. Bicarbonate 22 to 26 milliequivalent per liter. So here's the concept of compensation. What compensation refers to is that the body wants to maintain the pH of 7.40 all the time to have this normal pH floating around the bloodstream. We want our pH high or low, so if something happens, for example, if the ones that are causing the CO2 to become low, then the kidneys are going to have to kick in as a compensatory mechanism and try to balance out our pH. So there's a normal balancing act that occurring here between the lung and the kidney all the time in order to maintain a normal pH. Our compensation by the lung, as you may imagine, could be very rapid. All you have to do is to breathe faster or breathe slower to get rid of more CO2 or retain more CO2. On the other hand, the bicarb solve a bit more difficult because in order to change your bicarbonate, you're going to have to either retain more bicarb by the kidney or you're going to have to jump off more hydrogen ions. So we need to have some time in order to do that. It takes about 8 to 24 hours to get compensation out of the kidney, or it can take just a matter of minutes to get compensation out of the lung. For laboratory analysis, we're going to discuss the respiratory and metabolic acid-base nomenclature. For respiratory acidosis, uncompensated expect a result with acidotic pH, increased value of PCO2, normal bicarbonate, and base excess. Partially compensated, acidotic pH, increased values of PCO2, bicarb, and base excess. Compensated, you will get normal pH, increased value in PCO2, bicarbonate, and base excess. In respiratory alkalosis, uncompensated expect a result of alkalotic pH, low values of PCO2, and normal values of bicarbonate and base excess. Partly or partially compensated, you will get alkalotic pH, low values of PCO2, bicarbonate, and base excess. Compensated, you will get a normal pH, low value of PCO2, bicarbonate, and BE. For metabolic acidosis, uncompensated, you will get a result of acidotic pH, normal PCO2, low values of bicarbonate and base excess. Partially compensated, acidotic pH, low values of PCO2, bicarb, and base excess. Compensated, you get normal pH, low values of PCO2, bicarbonate, and base excess. Metabolic alkalosis, you'll expect in uncompensated, you'll get alkalotic pH, normal PCO2, high values of bicarbonate and BE. Partially compensated, you'll get alkalotic pH, high values of PCO2, bicarbonate, and base excess. And compensated, you will get normal pH, high values of PCO2, bicarbonate, and base excess. Interpretation. Respiratory acidosis is characterized by a lower pH and an increased PCO2 and is due to respiratory depression, meaning you're not getting enough oxygen in and carbon dioxide out. This can be caused by many things, including pneumonia, chronic obstructive pulmonary disease, and oversedation from narcotics. Respiratory alkalosis, characterized by a raise in pH and a decreased PCO2. This is due to overventilation caused by hyperventilating, pain, emotional distress, or certain lung diseases that interfere with oxygen exchange. Metabolic acidosis is characterized by a lower pH and a decrease in bicarbonate. The blood is too acidic on a metabolic or kidney level. Causes include diabetes, shock, and renal failure. Metabolic alkalosis is characterized by an elevated pH and increased bicarbonate and is seen in hyperkalemia, chronic vomiting, and sodium bicarbonate overdose. So let's practice to analyze ABG result. For the results, abnormal results of any of the blood gas components may mean that you're not getting enough oxygen, you're not getting rid of enough carbon dioxide, and there is a problem with kidney function. Factors that primarily affect the results of ABG test: drawing the blood sample from the incorrect patient, failure to obtain a blood sample from the artery of vein, blood clotting, obtaining a blood sample on incorrect settings or support, air contamination of the blood sample, contamination caused by too much heparin, inappropriate mixing of blood sample, and prolonged delays in the blood sample analysis. The following are the effects of blood gas contaminants to the parameters of ABG test. Excessive heparin causing decreased values in pH, PCO2, hemoglobin content, bicarbonate, and base excess. Air bubbles cause increase in pH, decrease in PCO2, bicarbonate, and base excess. I would like to share why ABG test is important during COVID-19 pandemic. Blood gas testing plays a critical role in managing infected patients and monitoring their respiratory distress. Arterial blood gas test provides the status of patients' oxygenation levels and enable healthcare providers to determine whether adjustments to ventilator settings or other treatments are required. And routine blood gas testing is also performed when patients require mechanical ventilation. So this slide is a good pointers to review or the summary on how we interpret ABG tests. And I think this will be my last slide. My references, and thank you for listening.